All right. Thank you very much, everyone. Uh, Today, my first day to come back for doing presentation using technology, Zoom, and also live stream on YouTube. I would like to thank you for those of you who've been following my channel and you've been supporting me throughout the past few years. And you can see my number of subscriber is growing um, higher, bigger number, get closer to 5,000 subscriber. I cannot wait. I will have some possible some gift for those of you continue actively support the channel to grow it and to use it at the platform to improve the dentistry and also life in general. Today, I have a very special topic that would be the how to use basic technology, just as like your phone and your some basic that stuff that you buy from Amazon, you can use and take good record for your patient, especially uh, general dentists who do cosmetic dentistry or orthodontists who want to use basic technology and invest minimum money into your equipment, but you can have your assistant do all these jobs. So I'm going to start with my presentation on how to take decent photo, intra and extra oral photo for this purpose. So let's jump into my presentation. And I'd like to thank you for those of you who join me in this live stream, okay? So here we go. I'm going to click on share. So my presentation today again is how to take intra-oral and extra-oral photo for dental assistant and new dentist. You know, those of you who put thousands of dollars into camera and things like that, I don't have any problem with that. But today my presentation is how to invest decent amount of money into your equipment of dentistry, dental equipment, and you can take decent record. And I'm going to show you the good and the bad thing about dentists or dental assistants don't know how to take good photos. So let's jump right in to teach you guys something today. So my goal today is to help dental assistant to want to grow their professional career, and also help dental assistant who want to work in cosmetic dentist or orthodontist. That's where you can be a good team player for your office instead of being the assistant that don't know how to keep good record, and also to help dental assistant who want to make more money than your current job right now. If you have more skill, your dentist will pay you more, your orthodontist will pay you more. And also I encourage the high school student high school student, middle school student, or college student who want to learn more about dentistry and how excited dentistry can be. So that's my goal, is to share the love of dentistry to you guys. Start with the basics is dental assistant. Why choosing dentistry? Well, dentistry is a great career, whether you are a dentist or dental assistant or dental hygienist. It's a great opportunity for high school and college kids to come into dentistry nowadays, because there's a big demand of dentists, dental assistant, dental hygienists, and even dentists right now after pandemic. Big demand, you guys. So that's exciting. Dentistry, it's fun, rewarding, unique career, and require dedication to career. It's actually less stress than in medicine compared to medicine. As for example, if you are a nurse, a medical nurse, and dental assistant, big difference. You know, less stress. You can go home early than the nurse. You can you have a good time talking with patients, meet new people every day of your work. Also, you gain a great dental and medical knowledge every day when you work with patients, and you can help yourself your children and your family. It's also a very flexible career. You can be a part-time dental assistant, part-time dental hygienist, part-time dentist, and also a very professional career. You help people to get the pain out of their pain, reduce the pain, anxiety, and help them look good. So a lot of opportunity to grow and become even a business leader, a manager, a researcher, and lecturer internationally, nationally, locally. And you can work for company, dental supply, or you can work in a hospital. There's so many opportunity. It's a wonderful career. So regarding to today's topic, like what are the armamentarium equipment required for you to take a decent photo for everyday intraorally? So I would say you can use, first thing that you need either a phone, a digital phone, an iPhone or Android phone. Second thing you need is an umbrella that you can buy, a light sort from, you can buy from Amazon. And you need a lip retractor, and I have some picture right here. You also need occlusal view mirror with fans. Nowadays they have the light, the mirror with the light, and there's a fence. It blow the air and the heat and stop fogging. And also, if you want to take good photo for from a studio, you can have the background. You can buy it on Amazon. Also, you need, if you don't have assistant, you can use your patient hand. But you have assistant, use your assistant hand. So anyway, before we jump in deeper conversation, I want to excitedly invite you guys, or those who you are dentists and who want to have a vacation this year. In June 8 to 10, 2023, this year right here, there is a big dental conference, Dr. World Gala, in Sardinia, Italy, or called Sardinia, Italy. That's where we host the big dental conference event. A lot of well-known dentists, researchers, medical, all kind of profession come together and celebrate. First time after pandemic, the World Gala, Dr. World Gala, beautiful red carpet celebration. And those of you who are in the top dentists, you can join this and receive an award. And do you want to learn more about this? Check out the Italian website, Italian Dental Association website, or you can check out, search on the Google, Dr. World Gala 2023. You're going to see this. Anyway, the next thing I want to go in right in just to show you a couple of pictures of the assistant taken for me. This is me, and I have a picture that the assistant take. And you can see the difference is when I stand and one direction to another, you can see it's just different. You can see it deeper. In this one, you can see like the room looks shorter, but here it seems to be like a room longer, depending on the light source. Another photo, how I turn around and how to take the picture. You can see it very totally, it's just same room, but it's just different appreciation, how the depth, how the photo look like. So in my reason I send this picture is just to let you know that when you take photo, there is an art involved. Now, so if you Google online, you can find out a bunch of sort of light like this that can help you very affordable. Less than $100, you can get the light sort that's showing to your patient face and teeth and have a brighter smile. And the next thing you search is I have a background here, the light sort. And the next one you want to get done is I would recommend for you, if you go to photodontist.com, Dr. Vule, he's selling this little light sort that you can attach to the phone, your phone. And when you take a picture close shot, you can have very nice detail of your patient teeth. I recommend you to check out photodontist.com, okay? And you're gonna see this device about $500, 400 something, but it's really good developed version of assistant light sort for your camera, your phone. Okay, so it's important to know that. Another device that I recommend is the the anti-fog mirror. When you put in a people mount and you hit the button right here, there's a fence and the light coming out, and it gives you a great photo. No fogging, successfully taking occlusal photo. So you need those two. Next one, I would recommend you to get on Amazon. For example, this is the lip retractor. The big one is for the upper and the lower one for the smaller. Another one is you can have these, very affordable plastic retractor for the lip, metal lip. All of these are affordable. The other one is the nice color, black color. So when you take a photo, it's really give the patient really white teeth, and that's not a retractor if you want to buy it. If you buy all of them, it's still less than $500. So here's another one, retractor, and another one on Amazon, background. And here's a picture of me using the device of photodontist light short. You can see that I can get closer and using my camera, using my iPhone and taking photo. The same thing here. I didn't use a very expensive equipment, just a phone, but the short light, more light coming in, give you a great picture, as you can see. So that's what you want to do. So here's an example of a decent photo when you take it for your patient. This upper row, you can see that really bright smile, bright teeth with decent right side and straight shot and left side shot. Here you can see the light short, it was weak, so you can see the color kind of dark. That's the second round. So again, the trick is you have to get enough light. The more light, you have better looking. Same thing here, as you can see, more light give you a more detail. I didn't use anything beside the iPhone. Here, as you can see, we didn't use enough light, so then you can see that kind of darker looking. And here's an example of an intraoral photo that consider reasonable, acceptable. For example, you got to retract everything. You got to retract everything. You got to get occlusal view, all of them. Like so, left, right, and occlusal. This is I could say acceptable intraoral recording photo. This is another one that's considered reasonable, acceptable intraoral photo. You retract everything, you see teeth everywhere. And another acceptable one, you can see that been everything retract, nice looking one. And I want to show you, this is considered not too good. His lip being pulled out here, you can see. So this is where you have to be aware more. When you take photo, you can identify the whether the photo is acceptable or not acceptable. This is decent, not so good, because the upper lip here is being close up. I don't like that. It could be the retractor is really small. So be aware of what you're taking. This is another decent photo that you can see. You capture the gum infection and all the teeth. Here's another one. I just want to show you a decent photo, but I'm going to show you something that, yeah, this is another decent photo. You get everything. Make sure you get the molar area here and everything. This is not so good fogging right here. You got to be taking another photo again. Here's another photo. This is decent, very decent photo. This is an example of the assistant don't know what to do. I gave her every equipment, but you see how she's taking the picture on the left side here. So it's terrible. It doesn't capture anything. And this is the proper occlusal picture of the same patient. You can see the molar here and everything. And this is how you see get it. You get too many stuff here. You get the face, the skin, and everything. And the nose. We don't need none of these. We need occlusal view, just like this. So when you take photo, make sure you got to go put the mirror all inside and don't have the fogging like this that occur. And here's another photo that this is what you want, but this is what you don't want. Why did you take photo of the people's face and skin and all of that? This is wrong right here, and this is reasonable, acceptable. So I want to show you bad photo and good photo. This is bad. You don't want anything like this. This just doesn't appreciate anything here at all. You got to cut everything, just focus on the teeth. There's not enough lights. That's why you can see really dark in here. Not acceptable. Here's another photo. This is like, would you take, you supposed to take close shot like this, not like this. Why you would capture nose, hair, skin, all of that? It's wasted. This is, so that I'm telling you, these are wrong shot. Okay, here's another occlusal view. What I don't like is you can see that capture the big tongue here is supposed to tell the patient swallow, pull the tongue back, and the lip here being not being retracted. So you can see capture missing the occlusal incisor edge of this canine. Not good photo, guys. Here's another not good photo. You can see it cover the lip here, not acceptable. Cover the lip here, not acceptable. Not acceptable. Compared to this is acceptable. This is not acceptable right here. And so again, make sure that this is acceptable. This is acceptable. This is acceptable. This is not a good example. See the lip, not good. Want you to see that. Not good right here. Not good right here. This is acceptable. This is acceptable. Occlusal is okay, but this is not too bad. Again, just similar photo that I showed you before. So again, this is a photo that we use in iPhone with some light sort from coming out of the divider I showed you previously. You see this gum infection there. So yeah, look at that. You want to take retraction like that, retract everything, show everything that you need to be recorded. So when you take photo, look for the detail. In conclusion, when you take intraoral extra photo, you need more light. You need a lot of light to get the clear and defined photo. Also, you make sure that you retract all the soft tissue and focus on the teeth. Make sure that you have the air suction system in a closer view so you don't have fogging. Evaluate your photo before you let the patient go. Don't let the patient go when you got to have a chance to review your photo first. Otherwise, you miss the opportunity to record that day. And also arrange your photo or your patient photo right after the patient left your office before you forget about it, because there's a lot of detailed document that you need to be document and follow your photo. It will save you a lot of time. And I just want to say thank you for you guys to watch my this presentation. And if you have any comment, feel free to ask me, especially dental assistant. If you're new to dentistry, pre-dental assistant, high school kid, you want to learn about dentistry, feel free to ask me question, comment below. I'm more than happy to answer your question. Again, I'm Dr. Win. Good to see you.